Okay, our last section here is professional caring and ethical practice. That's 20% of the exam or 30 questions. This is good news. 20% of the exam. Because if you understand their perspective, you're going to do well on this section. Professional caring and ethical practice. So what do you need to know about professional caring and ethical practice to do well on the exam? You need to know about their perspective, about the perspective of the American Association of Critical Care Nurses. So how do we find that out? We read about the synergy model. Conveniently, the synergy model is in your handout. Okay, so starting on page 126, you've got information about the synergy model. Now, the way that I would recommend that you read this is to take this content out of your handout. Draw yourself a nice hot bath. Get a glass of wine. Relax in the tub and read about the synergy model. It's going to put you to sleep, isn't it? Okay, so what we want to do, though, is you don't want to get out your highlighter. You don't want to highlight stuff. You don't want to memorize terms. What you want to do is to just learn their perspective. It's kind of like reading a novel. When you read a novel, you're not reading it to memorize stuff. You're reading it to learn about their perspective. Learn how these people think. And that's what we want to know. We want to know how these people think so we can answer the questions. Now, conveniently, they told you how they think in the synergy model. So let's take a look at that for a moment, and then we'll come back to our questions here. So just pull that out here for a minute out of your handouts, and let's take a look at it in the synergy model. First of all, they start out with talking about patient characteristics and then nurse characteristics. Let's take a look at our patient characteristics. Patient characteristics. Now, they talk about as being characteristics things like resiliency, vulnerability, stability, complexity, resource availability, participation in care, participation in decision-making, and predictability. Now, when they talk about these different concepts here, one of the things that they're talking about is the ability of being able to use these patient characteristics to help you to make assignments and to designate acuity. They may ask you a question on the exam about which patient is more acute, and they give you information that has nothing to do with physiology. There's no hemodynamic measurements, there's no vital signs, and you're like, how do I know? Look for these characteristics. Let's take a look at some of these. Resiliency. The ability of the patient to be able to bounce back. Who's going to be more apt to be able to bounce back? The 85-year-old or the newborn? Probably the newborn. Okay, so that's one of the things we can look at. The second characteristic is vulnerability. 85-year-old or newborn? Probably both, about equally vulnerable, right? So 18-year-old healthy male, less vulnerable. Stability. Okay, now this gets into more of the physiologic stuff we're used to. So is the patient stable? Complexity. How many previous comorbidities, etc., does the patient have going on that would contribute to their complexity? Resource availability. The available resources that we have in the hospital to care for the patient and the resources available to the patient after they leave the hospital. The homeless guy that lives under the bridge has very few resources available. Participation in care. The ability of the patient and family to participate in the patient's care. Now, the AACN feels very strongly that both the patient and the family should be able to participate in care. Okay, so that's going to be a big issue here. Participation in decision-making. Okay, so not that we know best for the patient and the family, but how can we help them to be able to make the best decisions about their care? Lastly, predictability. How predictable is it that this patient's going to be able to recover based on information that we know? Okay, now let's take all that information here for a moment. Let's take a look at a couple scenarios. We have an infant in septic shock. We have an 18-year-old who's involved in multiple trauma. And we have an 85-year-old who has, an 85-year-old homeless guy who has pneumonia. They may give you that kind of a scenario and say, which of these three patients is the most acute or needs the most nursing care or attention? There's no hemodynamic information. Okay? See, the normal way we associate acuity is with hemodynamics and vital signs and stuff like that, right? You don't have any of that. So assume they're talking about the synergy model. Let's take a look at these things. Which of those patients is going to be the most resilient? Again, probably the infant, maybe followed by the 18-year-old. Which is going to be the most vulnerable? Probably the infant and the 85-year-old, and not the 18-year-old. Stability, which one is the most stable? Well, they're probably all three of them fairly unstable. Okay? So let's say that they're all three of them are unstable. Complexity, which is the most complex? Probably the 85-year-old. Okay, now we're not talking about teenage issues here, okay? Okay, so probably the 85-year-old, right? Resource availability. It's assumed that the infant has resources available through the parents. So we're not going to assume that this infant is given up for adoption or something like that. We're going to assume that the infant has parents and that the parents have resources. So the one who would not have resources would be the 85-year-old homeless guy. Participation in care. Now remember, when we're talking about participation in care, we're talking about patient and or family. So again, the infant, even though you may say, well, the infant can't participate in care, family can. Out of the three, who's the least likely to be able to participate in care? Probably the 85-year-old homeless guy, because he doesn't have any additional resources to participate in care with him. Participation in decision-making. Again, when we're talking about decision-making, we're not only talking about the patient, but also talking about the family and their network of resources. So even though you may say, well, the infant can't participate in decision-making, you got the parents. So again, we're probably going to side there still with the 85-year-old homeless guy being the most acute on that part. Predictability. Well, the course of the 18-year-old is probably the most predictable. The course of the infant with sepsis may be a little bit unpredictable. 85-year-old homeless guy with pneumonia, probably really unpredictable because we don't know how much other stuff is going on with that patient. So now when you look at those three patients, when I first gave them to you, probably a lot of you were picking the 18-year-old multi-trauma, weren't you? That's the most. Or maybe if you don't work with kids, you were picking the infant because you're thinking, I don't work with kids, right? Now that'd be the most acute patient of mine, right? But probably using the synergy model, the most acute of those three, or the person who needs the most attention, is the 85-year-old homeless guy. Can you see how we might use the synergy model to help us to make that decision? That's thinking differently than we normally think, isn't it?